the left coronary artery traverses in the initial part. As soon as it reaches the groove between the left auricle and the aorta, pulmonary trunk, it divides into two branches, anterior interventricular branch and circumflex branches. So, we have seen the short course of left coronary artery. It is in comparison with the right coronary artery. If you see, the right coronary artery traversed the right part of the anterior AV groove and posterior part of AV groove to terminate. But this trunk of left coronary artery is very short, just passing behind pulmonary trunk, reaching the groove between the pulmonary trunk and auricle. It has terminated into two branches, anterior interventricular and circumflex branches. The trunk of the artery, that is left coronary artery, has not given any branch except this terminal branches. Now, we have to see the course of anterior interventricular and circumflex branches. The anterior interventricular artery is the continuation of left coronary artery. It runs in the anterior interventricular groove like this. So, this is the continuation of left coronary artery. If it runs in the anterior interventricular groove, then it winds around the apex of heart. In this groove, it is accompanied by great cardiac vein. The anterior interventricular artery ends with anastomosing the posterior interventricular branch in posterior interventricular groove. If you ask exactly where this anastomosis takes place, it is in the posterior interventricular groove at the junction of anterior 2/3 and posterior 1/3. That is the place where the anterior interventricular artery terminates with the posterior interventricular artery. So, this is the course of anterior interventricular artery. It is simple, it runs in anterior interventricular groove. One structure accompanying the anterior interventricular groove the student should remember is the great cardiac vein, and termination by anastomosing with the posterior interventricular branch. So, if we see next what are the branches of anterior ventricular artery, again it is running in between two ventricles, that is right ventricle and left ventricle. Then naturally it will supply right ventricle and also left ventricle. We have already seen right ventricle is mainly supplied by right coronary artery, except that strip along the anterior interventricular groove. That strip of the right ventricle is now going to be supplied by this anterior interventricular artery, and mainly the left ventricle is now supplied by anterior interventricular artery. So, that is how the branches of anterior interventricular artery we are going to see. The anterior ventricular rami supplying the right, they are small 1 to 2, and in this, as we have already seen, the left coronary artery anastomosing with right coronary artery, this will be the one of the branches of anterior ventricular rami, that is supplying the right ventricle from anterior interventricular artery. Then if you see the left branches of anterior interventricular artery, they are many, 2 to 9. They are large branches arising at acute angles. As in the right coronary branching pattern, I told the right coronary branching pattern is at right angles and left coronary branching pattern is at acute angle. In this, one of the important branch is the diagonal artery. In this picture, you can see this is the diagonal artery, which is one of the large ventricular rami. Sometimes this diagonal artery may arise from left coronary artery. So, you think the left coronary artery is giving the diagonal artery, then this left coronary artery will appear as if it has trifurcated into anterior interventricular branch and left circumflex branch. So, till now we are seeing the branches of left coronary. In these branches, we have seen the first one branch, anterior interventricular branch we have finished. Now, we are going to see the next branch, circumflex artery. Circumflex artery, as the name itself implies, it will circumflex around the left margin of the heart to reach the posterior part of AV groove. As we already saw, the right coronary artery will anastomose with circumflex artery slightly to the left of the crux. So, that will be the major course of circumflex, and that now we will see the course. Before this, this anterior interventricular that important branches supplying the septal rami is also we have to remember supplying the antero-superior 2/3 of ventricular septum. Circumflex artery passes along the left part of the AV groove. As I already told, this left part is very small part because it is obscured by the pulmonary trunk. In this left part it traverses and winds around the left border of the heart. Then it reaches the posterior part of AV groove, anastomoses with right coronary artery. That is the major course of circumflex artery. The applied importance of circumflex artery, the position, we will see again the total applied importance of coronary artery as a whole, but this applied importance of this circumflex artery situation I have to tell now. The circumflex artery lies very close to the mitral valve annulus and often damaged in the mitral valve replacement. So, this situation of circumflex artery is important for the surgeons situated close to the mitral annulus. That is this important feature we have to remember. Branches of circumflex artery, atrial and ventricular rami supplying the left atrium and left ventricle, and in this the important branch is the left marginal artery which runs along the left border of the heart towards the apex. This left marginal artery is the prominent branch. Again I have to tell the applied importance of this left marginal artery. This usually the vascular graft is anastomosed to the left marginal artery distal to the site of obstruction. So, we have now seen the branches of circumflex artery. The constant branches we saw, now we will see the inconstant branches. Sometimes sinoatrial nodal artery in 35%, AV nodal artery in 20% and posterior interventricular artery in 10 to 20%. So, this finishes the branches of circumflex artery. And one more important again that may be we can call as the inconstant branch only, that will be the Kugel's artery. Kugel is the name of the person who described this, and it will be called as Kugel's arteria anastomotica magna. That is, this circumflex artery supplies the part of the interatrial septum. So, still now we saw the arteries which supplied the interventricular septum. First, this interatrial septum will be supplied by the circumflex artery branch called as Kugel's artery, and it will anastomose with a similar branch from the right coronary artery, and that will be called as Kugel's anastomosis. So, like this we saw the important branches of all the three important arteries which supply the heart. If I summarize the important branches of the three arteries which supply the heart: right coronary artery important branch, posterior interventricular branch. Left coronary artery divides into anterior interventricular and circumflex. If I tell the important branch of anterior interventricular, we have to remember is the diagonal artery. If I again want to tell the important branch of the circumflex artery, the name which we should not forget is left marginal artery. Lastly, inconstant branch of circumflex artery we gave some name is the Kugel's artery. Like this we saw elaborately the branches of the arteries which supply the heart. So, I have already described this Kugel's anastomotic artery, constant branch from circumflex artery which traverses the interatrial septum to anastomose with the branches of right coronary artery. We have described this already. So, we can now summarize the left coronary artery. The left coronary artery supplies most of left atrium like this and most of left ventricle, if you observe in the picture, except this strip along the posterior interventricular groove, and also it supplies the antero-superior 2/3 of the ventricular septum. So, this is the summary of left coronary artery. Before we go to the next important applied aspects of the coronary artery, we can see the coronary anastomosis. This coronary anastomosis we can see under the two headings, intracardiac anastomosis and extracardiac anastomosis. Then in the intracardiac anastomosis, between the branches of coronary arteries. This branch, between these branches of coronary arteries, they may be in the subepicardium or in the myocardium or in the subendocardium. That may be the one anastomose. Then it will be between the arteries and sinusoids. Again, if you should ask me suddenly what sinusoids, we are now speaking about coronary arteries, suddenly sinusoids, then that is the coronary arteries at places break into sinusoids. So, this arteriosinusoidal anastomosis may be present at times at some places in the myocardium, and sometimes this coronary arteries may anastomose directly with the cavity of the heart. It will be called as arterioluminal, and this anastomosis may be between the arteries and the veins, then it will be called as arteriovenous. So, these are the various intracardiac anastomosis between the interarterial branches or between the arteries and veins or between the arteries and sinusoids of coronary arteries or between the arteries and the cavities of the heart, cavity of the heart. So, this is intracardiac anastomosis. Then what is extracardiac anastomosis? Then that is between the coronary arteries anastomosing with the adjoining branches of pericardium, for example, pericardial branches of descending aorta, or it may be from internal thoracic artery. So, these are the various types of coronary anastomosis described. In this, intracardiac interarterial anastomosis is important, and the other types of anastomosis, that is between arteries and veins, between arteries and sinusoids, between arteries and lumen of heart, they are all doubtful, and the authors, so many doubts, so many authors are raising. So, we will be seeing mainly this intracardiac anastomosis, interarterial anastomosis and extracardiac anastomosis, as I already told, with the branches of internal thoracic artery. Other anastomoses doubtful are arteriovenous, arterioluminal and arteriosinusoidal. So, we have finished the major aspect of this coronary arteries, how elaborately, how they take origin, how they course, how they divide, and then we saw the branches of the branches of left coronary artery, like that we saw in elaborate. Now, we will see the important aspect, applied anatomy of coronary arteries. The first applied aspect, if I tell sudden cardiac death, when the left coronary artery arises from anterior aortic sinus. When the left coronary artery arises from, as you are seeing in this picture by the dotted lines, if you think the left coronary artery is arising from anterior aortic sinus instead of left posterior sinus and passing behind the longer course behind the pulmonary trunk, then it may be compressed between the pulmonary trunk and the aorta. And usually this will happen, you would have heard in so many times, the athletes suddenly collapsing after severe exercise. One of the causes of sudden cardiac death may be this, the left coronary artery arising from the anterior aortic sinus. The next applied aspect we are going to see is the coronary artery disease. Coronary artery disease is the obstruction of the coronary arteries by the atheromatous plaque. This coronary arteries, the main arteries or its major branches, if it is blocked by the atheromatous plaque, then this atheromatous plaque breaking and forming a thrombus, then blocking the coronary artery. So, this causes the coronary artery disease. Coronary artery disease, we can have the following varieties: angina pectoris, that is spasmodic obstruction of coronary arteries. So, the students should understand the difference between the angina pectoris and the myocardial infarction. In the angina pectoris, that is the spasmodic obstruction of coronary arteries. So, the patient will complain of chest pain, and after sometimes the relief will be present. So, it is temporary, and this myocardial infarction is the sudden and complete obstruction of major arteries by the thrombus. The coronary artery disease, the frequencies, if you see if in which part of the vessels they affect, first to 2 centimeter of the vessels, and frequency is mainly anterior interventricular artery 40 to 50%, right coronary artery 30 to 40%, and the circumflex artery less. Other infrequent sites are diagonal artery, left marginal artery, and left coronary artery trunk itself. So, these are the various arteries which may be affected. Then how to investigate? The non-invasive methods, CT angiography or the MR angiography. Invasive methods, coronary angiography. So, these are the CT angiographic images. So, this is these pictures are taken from CT angiogram, non-invasive procedure. Then this is the invasive coronary angiography by introducing a catheter into the major upper limb arteries or lower limb arteries. Then once the catheter enters the ascending aorta, guide wires will be introduced, high osmolality contrast medium will be injected, then different views like direct frontal, right anterior oblique, left anterior oblique will be taken. So, some views will better reveal the right coronary artery, some views will better reveal the left coronary artery. These are the coronary angiographic images, in which in this left picture you are seeing the left coronary artery dividing into anterior interventricular and circumflex artery. Then if what are the treatment modalities for the coronary artery disease? Balloon angioplasty, that is for mild stenosis. This treatment will work. Balloon angioplasty followed by the insertion of stents. This balloon exerts pressure against a wall, plaque in the anterior wall, fractures and splits the plaque, thereby increase in the arterial lumen. And if you have the major stenosis or high grade stenosis, all the 3 vessels are affected with impaired left ventricular function, then the treatment modality is coronary artery bypass grafting, and the common grafts are from saphenous vein and internal thoracic artery. They have studied, they have followed up these grafts for 10 years, and they have understood this internal thoracic artery grafts play the better role than the great saphenous vein grafts. Lastly, we will see in short, in brief, the venous drainage of heart. The venous drainage of heart, 60% of the venous blood drains into right atrium by coronary sinus, and 40% into various chambers by venae cordis minimi and anterior cardiac veins. So, this is the coronary sinus. This is a large vessel, wide 2 to 3 centimeter long, present in the posterior part of AV groove. It begins in the left part of the AV groove, receiving the great cardiac vein, and it runs to the right along the posterior part of the AV groove, then reaches the sinus venerum of right atrium. Tributaries of coronary sinus, great cardiac vein, middle cardiac vein, small cardiac vein, posterior vein of left ventricle and oblique vein of left atrium. The great cardiac vein lies, as we told already, it lies in anterior interventricular groove. Middle cardiac vein lies in posterior interventricular groove. Small cardiac vein lies in the anterior part of coronary sulcus. So, now we will summarize. Students, we will summarize the arterial supply and venous drainage of heart. The arteries, main arteries we saw today are the right coronary arteries and left coronary arteries. They arise from the aortic sinuses. The right coronary artery runs in the anterior part of the coronary sulcus, winds round the inferior border of the heart, reaches the posterior part of coronary sulcus, terminates with the anastomoses of circumflex artery slightly to the left of the crux. Branches from right coronary artery from the first segment supply the right atrium and right ventricle. Important right ventricular branches are right conus artery, right marginal artery. Important right atrial branch, we saw the sinoatrial nodal artery. As the right coronary artery reaches the crux of the heart, it gives the posterior interventricular branch. This posterior interventricular branch supplies the inferior part of the ventricular septum. The left coronary artery arises from left posterior sinus. It takes the course behind the pulmonary trunk to reach the groove between the pulmonary trunk and the left auricle. Then it divides into anterior interventricular and the circumflex branches. This anterior interventricular branch runs in the anterior interventricular groove, then winds around the apex of the heart to anastomose with the posterior interventricular artery in the posterior interventricular groove. This anterior interventricular artery supplies the strip of the right ventricle and mainly the left ventricle. Important branches on the right side are left conus artery. Important branches on the left side are diagonal artery. Then this circumflex artery runs in the left part of the AV groove, winds around the left border of the heart to reach the posterior part of the AV groove. As already described in the right coronary, the left circumflex anastomoses with right coronary artery slightly to the left of the crux. Branches from circumflex artery, important branches on the ventricular side, left marginal artery. If you see on the atrial, on the back of this, in the posterior aspect, they supply the left atrium and the left ventricle. And inconstant branches from this left circumflex may be sinoatrial nodal artery or the AV nodal artery or the posterior interventricular. In this class, we saw the important aspect, the cardiac dominance, that at least that basics should be understood completely. The cardiac dominance is determined by the continuity of the posterior interventricular branch from either from right or from left. So, the right is more common in 60% and left is less common in 10 to 20%, and some are having balanced type, that means this posterior interventricular branch may arise from right or left. In this, right cardiac dominance is good, left cardiac dominance is sometimes if the one vessel is blocked, the entire left ventricle is going to be affected, and the balanced type is also good for the persons. So, this is finishes the arterial supply of the heart. If we see the venous drainage of the heart, the 60% of the venous blood drains from the coronary sinus and 40% from the anterior cardiac veins or from the minimal cardiac veins. This coronary sinus is present in the posterior part of the AV sulcus, and then it ends in the right atrium between the right atrioventricular orifice and the opening of inferior vena cava. This coronary sinus has major tributaries: great cardiac vein, middle cardiac vein, small cardiac vein, posterior vein of left ventricle, oblique vein of left atrium. So, this we saw the important gross anatomical features of the blood supply of heart. In the applied aspects of the heart, in the applied aspects of the blood supply of the heart, I told the coronary artery disease and the sudden cardiac death in the athletes. Sudden cardiac death in the athletes is if the left coronary artery arises from left aortic sinus and this part is compressed between the pulmonary trunk and the aorta. The persons, athletes, they are exercising, suddenly collapsing, that may be the cause, one of the causes, not one of the causes of sudden cardiac death is this. And we saw the next coronary artery disease. This major cause is the atheromatous plaque, this giving rise to the thrombus, and we saw the first 2 centimeter of artery will be affected, and the important arteries affected are anterior interventricular artery and then the posterior and then the circumflex artery and then the right coronary artery and the left circumflex artery. This coronary artery disease can be evaluated by invasive or non-invasive methods, and they can be treated by balloon angioplasty or by the coronary artery bypass grafting, and we have seen the coronary artery bypass grafting in this internal thoracic artery grafts is important. So, that is the we have seen the blood supply of the heart, students. This we will discuss again the importance. I think if in the next sessions we will continue with the other importance features if we have in the blood supply of heart. Okay, thank you.